I am monitoring the waiting room. I don't have anyone currently in the waiting room. Oh, I do have one person. I do not have any subcommittee members in the waiting room currently that I can see.
Okay. No, we were going to be a little tight today for quorum. Uh, Joseph, do you mind reminding us if we don't have quorum today, we're able to still receive presentations, just not approve anything? Is that correct?
That is correct. You guys could move forward with presentations. You just couldn't vote on anything, not even the minutes.
Okay, thank you. And to clarify, if we magically get quorum, can we return, establish it, and then move back to the other agenda items? Is that correct?
That is correct.
Thank you. My ability to Robert's rules outside of the Robert's rules gets a little hairy sometimes, but I know we have some guest presenters today. So let's go ahead and get started so we can optimize the time of our guest presenters, and then
recording in progress.
Hopefully we'll be able to establish quorum during the meeting. So let's go ahead and move on to agenda item number 1, which is a call to order and the roll call to establish quorum. I'm going to turn it over to Kim from the SEI team to help us out with that.
Thank you. And so when I call your name, if I could ask prevention subcommittee members that are here to please come off mute and indicate verbally that you are here at the meeting with us. I will start with Jessica Johnson.
Present.
Eric Schoen. We did not expect Eric, but just confirming. Angela Nichols.
Your meeting ID
Present.
followed by pound.
Oh. Angela, I just want to confirm we had some overlap, but I heard you say you were present, correct?
I am not present, yes. Any numbers.
Thank you. All right. And then Senator Donate. I don't believe we have the senator, which at 2 members, I do not believe we have quorum.
Okay.
You are in the meeting now. Are more than 20 participants.
I am just waiting because we had one phone number call in, and just in case that phone number might have been the senator, I wonder if we just want to wait one moment till the phone gets connected and then just do a quick double check.
Terrific.
And that phone number is in now. So just one more check to see if the senator is on the call with us, Senator Donate. Okay, I'm not hearing response. I'll monitor, and if I see additional folks come in that I believe are subcommittee members, I'll elevate that to the group so we can try and establish quorum at that point.
Okay, thank you, Kim. Before we move on to the period of public comment, just if you've only dialed in on the phone, if you're able to mute on your end, that would be helpful for just regulating sound and folks talking over. Thank you. All right. We will move on to agenda item number 2, which is our period of public comment. I am going.
Hold on. Sorry, Jessica. I'm working to mute some folks. All right. There are free folks I can't mute. Can I ask the phone number that is 7494 to let me know which individual you are, and I can merge your account, merge your Zoom? Okay, it might be resolved. I think it's resolved.
Fantastic. Let's move on to agenda item number 2, which is the period of public comment. I am going to turn it over to Kim to ensure that we have all of the details we need appropriate to public comment.
Thank you. All right, so public comment will be received via the Zoom meeting. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. If you are dialing in from a telephone, you will want to press *6 so the host can prompt you to unmute if you do have public comment. We also ask that members of the public refrain from commenting outside of the designated public comment period unless specifically called upon by the chair.
Thank you, Kim. Do I have anyone here today for public comment? If so, you're welcome to raise your hand or take yourself off of mute.
Yeah, I'm not seeing anyone with a hand up or that is unmuting themselves.
Okay. I'll hold for just one more moment. All right. With that, let's move on to agenda item number 4. Since we'll be able to receive our presentation, I don't believe we've established quorum yet. So this is a presentation on naloxone distribution in Nevada Hospital Emergency Departments by our friends at the Nevada Board of Pharmacy. Thank you for being here today. A little bit of background on why this is being introduced. The Prevention Subcommittee has received a recommendation, that's mine, around learning more about the rules and regulations around hospital distribution of naloxone at hospital emergency departments. So I will turn it over to Darla, if you are going to be sharing the presentation today, or whomever from the Board of Pharmacy team.
And I do see both Darla and Dave present. So I think we'll just have confirmation. Oh, it looks like Dave had to step away. And Darla, we're not able to hear you.
Can you hear me now?
We
Yes.
can.
Okay, perfect. So for some reason, I can't share my screen.
Let me stop sharing. How about you can try now?
Okay, can you see that now?
Yes. We are seeing your PowerPoint version not in presentation mode, but it looks like you're about to put it in presentation mode.
Yes, absolutely. So as she said, I am Darla Zarley with the Board of Pharmacy, and I'm here today to talk about the naloxone distribution in hospital emergency departments. And so first of all, I just wanted to go over with you what the laws are around naloxone.
And Darla, I'm sorry,
So
sorry, Darla, I just wanted to let you know that we can see your view rather than the presentation view. If that's the view you'd like to show, that's absolutely fine. We just wanted you to know we can see the notes version.
I thought I was in presentation view.
Yeah.
Let's see here.
You are. I think if you go to display settings, it should be able to switch it to presentation mode for us. Swap.
Yeah.
The presenter view and slide view.
Is that better?
Yes.
Perfect.
Does that work?
Yeah, that looks great.
Okay. Perfect. Okay. So the 2015 legislative session, the Good Samaritan Drug Overdose Act passed, and this law, things that were implemented in this law or this act, it was preventing punitive actions against healthcare professionals and any person who administers naloxone or calls 911 to assist somebody who may be overdosing. It provides immunity to persons seeking medical treatment for opioid use or opioid overdose for themselves, allows greater access to naloxone and opioid overdose reversal drugs, and naloxone is available at area pharmacies and can be obtained without a prescription. So the Good Samaritan Drug Overdose Act, which is found in NRS 453C.100, what the law currently allows is a healthcare professional, so someone who is authorized to prescribe an opioid antagonist, may directly or by standing order prescribe and dispense an opioid antagonist to a person at risk of experiencing opioid-related overdose, or to their family member, friend, or other person. And what they mean by a healthcare professional here is a nurse practitioner, a physician assistant, or a medical doctor. And then any individual who is acting in good faith, who prescribes or dispenses an opioid antagonist is not subject to any criminal or civil liability or any professional disciplinary action for such prescribing or dispensing, or any outcomes that result from an eventual administration of the opioid antagonist. A law enforcement officer also may possess and administer an opioid antagonist. I know this is, you wanted me here for a hospital emergency departments, but I just wanted to let you know how or who can have access and hand out naloxone. And then an emergency medical technician, advanced emergency technician, or a paramedic is authorized to administer opioid antagonist. And then another part of the Good Samaritan Overdose Act is a person who is acting in good faith with reasonable care. If they administer an opioid antagonist to, they believe, someone who is experiencing an overdose, they're immune from criminal prosecution and sanctions any professional licensing statute and civil liability for such act. And the provisions of this subsection do not create any duty to prescribe or dispense the opioid antagonist. What this law also does is it authorizes them to store and dispense an opioid antagonist. So any person acting under a standing order issued by that healthcare professional may, who is authorized to prescribe an opioid antagonist, may store an opioid antagonist without being subject to the registration and licensing provisions of Chapter 639, which is our chapter here at the Board of Pharmacy, and may dispense an opioid antagonist if those activities are undertaken without charge or compensation. The other way that a patient can get naloxone is a pharmacist can furnish an opioid antagonist to a patient without a prescription. They just have to come into the pharmacy and purchase it there. And there's pharmacists must provide education to the patient, but they do not need a prescription in order to obtain it. And the other thing that I wanted to stress is that naloxone is actually over the counter now. So they can purchase the over-the-counter naloxone and hand it out to anyone. It was approved in March 29th of 2023. It's available on all 50 states over the counter, and it does not require a standing order to do so. So the important point here is the fact that naloxone currently is available for healthcare providers to give out in the emergency room department. They just need to put a standing order in place if they're going to use the prescription naloxone, or they can hand it out if they have the over-the-counter product on hand.
Thank you, Darla. Does that conclude your presentation? Are you open for questions?
Yes, sorry.
Okay, no
I
worries.
am open for questions.
Okay, wonderful. Thank you for that presentation and overview. So I think just to summarize, you're sharing that if a hospital wants to prescribe the naloxone, they would need a standing order for the hospital to do so.
So, yeah, so any emergency department at this point can hand out naloxone. So if they have the naloxone that is a prescription naloxone, they just have to have a standing order in place and signed by their healthcare professional, have on file at the hospital, and they can hand out naloxone. Whatever, they just have to put in the standing order how they're going to do that.
Fantastic. And so it wouldn't necessarily, so if they have the standing order, it wouldn't necessarily have to be a patient of the hospital, could be a friend, a family member, a community member stopping by, sort of in whatever is in that
Yep,
standing order.
anyone. Absolutely, anyone.
Okay. All right.
And the standing order can be as broad as exactly what you list. They don't even have to put a laundry list of individuals who can receive it. It's just if they, you know, would like to get the naloxone and have it on hand. Again, that standing order can be that bag. It's whatever they put in their standing order. Each hospital can do it the way they want to.
And if a hospital were interested in something like a naloxone kiosk or a vending machine, would that need to be included in the standing order, or could it just be a distribution site under like a community standing order?
So if they're going to use the over-the-counter product, they don't need to use a standing order at all. They can just do the vending machines or a distribution location. They don't have to have the standing order. But if it is the product that is a prescription medication, they need the standing order in place.
Okay, that's helpful. I'm seeing Dr. Kearns with her hand raised from our response subcommittee. Dr. Kearns?
Thank you, Chair Johnson. This is kind of similar to the emergency room distribution, but I wondered also for paramedics, EMS, can they do leave behind programs if they are out and go to the site of an overdose and want to leave it with the family and friends, not in the emergency room, but at the site that they respond to?
So under this, it just says they're allowed to administer it. But if they had a standing order in place from a physician, they could do it.
Thank you.
Thank you. And while I do see another hand raised, this is an opportunity for committee members to ask questions. So Dr. Strom, I know you're not a prevention committee member, so apologies for that. Prevention subcommittee members, any additional questions?
Harry, may I add one more thing to that? So if it is the over-the-counter product, they can hand it out. It's just that prescription product that requires the standing order. So I just wanted to clarify that. I apologize.
No, thank you for that clarification.
Thank you. Any additional questions? Yeah, Dr. Strom, if you're interested in raising your question during the public comment period, we'd be able to receive it, but I recognize that that's not until the end. All right. Think that Dr. Kearns?
I'm so sorry. Another question came up. If it's in the emergency room or in like a kiosk, as was suggested by Chair Johnson, the pharmacy at the emergency department or hospital doesn't have to be involved with that distribution, or?
They do not.
I mean, okay.
Whatever the standing order is, whatever they have in the standing order is how they would put that in place with their distribution. So the pharmacy does not have to be involved at all.
Okay, thank you for that clarification. I really appreciate your receiving your presentation today, and I know as someone who's been identifying and championing this recommendation, I appreciate hearing more about the details of it.
You're welcome.
All right. With that, so I think that concludes agenda item number 4. Just checking, Kim, we have not established quorum?
We have not. Let me confirm that we haven't heard. No. So as far as I can tell, we have not established quorum, but I can do a quick check to just ask if Senator Donate has been able to join us. Senator, if you've been able to join us, could you let us know you're on the call? And or Eric Schoen, who I don't believe we expected to be present.
Correct.
Just covering all bases, just in case. Okay, so no, I do not believe we have quorum.
All right, thank you for clarifying. So with that, I know this is a discussion only item, and I'm hopeful that our DAG can guide me if I am stepping out in any way. Just confirming, Joseph, that we're able to still proceed with any discussion only items on the agenda.
Hey, Jessica, what was the question?
Thanks. I just wanted to confirm, since we still are working to establish we don't have quorum, that we're able to proceed with any discussion only items, or would those need to be
Discussion only is totally fine. Sorry, I didn't mean to
okay.
interrupt.
No. Thank you. That's what I needed to know. Just making sure I'm in line with the rules around here. So for agenda item number 5, we are going to discuss any of the proposed 2025 Prevention Subcommittee recommendations. We have 3 recommendations. Oh, thank you, Kim. Do you want to just remind folks of the process?
Sure. So just as a reminder to our prevention subcommittee members, please submit any recommendations that you'd either like new recommendations, or if you'd like to elevate, amend, or edit any existing recommendations, to submit those via SurveyMonkey. You should have those links from me in your email. If you need them again, just feel free to reach out and I can send them over to you. We do ask that folks submit those ideas as early as possible, as all subcommittee members are encouraged to submit at least one recommendation. The SurveyMonkey does require you to fill out quite a bit of information to submit before you can press the submit button. So if you're not at a place where you feel like you have all the background content ready, feel free to put in a recommendation and add placeholder language in any of the required sections, or put a note in there that says, Kim, please follow up with me, and I'm happy to connect with you one-on-one and help you complete the requested information that otherwise you could submit on your own via the SurveyMonkey as well.
Thank you, Kim. So to date, we've received 3 recommendations. The first one is to continue with the cannabis recommendation from the 2024 report. And I believe we've been working with a statewide subject matter expert to receive an updated presentation on this recommendation that we weren't able to secure for today, but hopefully at a future meeting. The next recommendation we've received is re-elevating and a refinement on the 2024 recommendation related to an investment in primary prevention programming, and the additional refinement of this recommendation submitted by Vice Prevention Subcommittee Vice Chair Eric Schoen included what's underlined here.
And just as
And
a note, Jessica, the underline is the adjustment to the recommendation.
Thank you. And the SEI team has secured us a speaker for the November Prevention Subcommittee meeting to provide more details on this and any additional or updated recommendations. And then this recommendation, which is mine, um, has been elevated. I really appreciate the information from today, and for the purpose of keeping this discussion only, won't make anything that we have to vote on, but I do think the opportunity to amend based on what Ms. Zarley presented today, or Dr. Zarley, on additional recommendations for how to promote some of the clarification that was provided on this subcommittee is the direction I think that would be most beneficial for this recommendation. So I'd encourage all prevention subcommittee members to at least elevate or submit one recommendation for this year so that we can carry this into our, I know the timeline's changed a little bit, but into the 2026 recommendations for the committee. Thank you, Kim. I know that the SEI team has been gathering from our July full surge meeting some opportunities for additional recommendations based on the very robust speaker panel that was received. So Kim, do you want me to talk through these in turn, or?
I'm happy to support. However I can help, just let me know.
Sure. Yeah, so if you don't mind just summarizing briefly, that would be helpful.
Yeah, so there'll be 2 slides. This is the first of 2 slides of, as Chair Johnson noted, from speakers that presented at prior full surge meetings that provided information that felt relevant to the prevention subcommittee specifically, rather than other subcommittees. And so you can see here that on the topic, the presentation drug testing performed by public health programs, which was presented in July, which I would also note that folks that are interested in more information can go on the SURG website and see the full presentation or view the recording of that presentation if you'd like to see it in context. But information that we've pulled out as possible recommendations from that presentation were to have labels on products that might have drugs embedded in them, similar to how food or drinks have warning labels for allergies or alcohol. Provide drug checking services tailored to local conditions through community and consumer input and use of multiple strategies to promote safer drug use practices. And so that is test strips, the FTIR testing, and then also the GCMS, LCMS. And each of these offers kind of pros, cons of those approaches, which are lower cost and or lower barrier, and might be quicker, and then which might provide more information, but might be a slower response time or have a higher cost. So that's that one. I'll pause there. Chair Johnson, anything else to add before I go to the next slide?
No, thank you. Thanks for pulling these together.
And then the next one, also from the July full surge meeting, there was a presentation on surveillance of the Clark County illicit drug supply. And from that, some possible recommendations that could apply to the prevention subcommittee's work is that having laboratories with capacity to test substance samples from residues on used drug paraphernalia or samples taken from community member supplies. So similar to the prior slide that also had to do with testing. Having accessible sites for community members to submit substances and or paraphernalia to sample for rapid testing and reporting. Expansion of harm reduction centers, including potential overdose prevention sites, and then expanded access to free naloxone for community members, such as you can see below, through public health vending machines or distribution partners. Okay. Anything on
Thank you
that
for
before I move
compiling
on?
these.
Yeah.
Yeah, so just curious, I think, Angela, if there are any recommendations for speaker requests for upcoming meetings. I think that we are open to that related to recommendations that we have or potential recommendations that could be considered. So happy to entertain any speaker requests.
I don't have anything specifically,
Okay,
but
wonderful.
I'll
Thank
think
you.
on it.
Okay, fantastic. And feel free and provide those to the SEI team. We can work together to make sure folks are available for our meeting times.
Thank you. I'll just note, Member Nichols, that you do not need to go through the SurveyMonkey to do a speaker request. That would be quite onerous, so you're welcome to just email me directly with any ideas or requests.
Very well, thank you.
Fantastic. All right. With that, we'll close agenda item number 5 and move on to agenda item number 6, where we'll review progress on the prior surge prevention subcommittee recommendations.
Sorry, I'm going to be pulling up a PDF. So there should be a PDF on the screen now instead of the slide deck.
Thank you.
And would you like me to, oh, go ahead.
Go
Sorry.
ahead. No, I was just going to say, just hopeful that if people are, if committee members are looking at prior surge prevention subcommittee recommendations, this document does have a compilation of reports received by the SEI team to date related to these recommendations.
And I would just note that the most recent version we provided, and that is also posted to the SURG site, also gives updates from the legislative session as relevant around ABs and SBs that passed or did not pass that might be applicable to those recommendations. I'm not sure if you wanted me to provide an update on that. I think there's 3 or 4 within this document.
If we can just highlight the ones that are related to, it looks like the funding recommendation from 2024, the tobacco recommendation. Oh, sorry, Kim, you know this document better than me. I'll let you share.
No. So the first one, as you noted, in 2024, there's a recommendation to require the State Office of Medicaid to develop a state plan amendment. You can see that in 2025 legislative session, AB 340 would have required certain health insurance to include coverage for certain elements related to fetal alcohol spectrum disorders. That one had no further action as of 6/3/25. Similarly, in the same legislative session, there was SB 300, which requires Medicaid to cover services provided by a psychiatrist or other professionals to cover services provided by a mental health counselor. That was approved by the governor on 6/10/25. So that one proceeded through. If we scroll through, it's handy because they are mostly in bold, so relatively easy to find. You can see another recommendation, which was to recommend a bill draft request to support legislation that would help to fund or establish a statewide association for peers. You can see that there are several similar recommendations that have gone forward over the years. Related is AB 60, which requires certification of prevention specialists and prohibits minors from providing or supervising peer specialists in most circumstances, and that was approved by the governor on 6/3/25. I believe there is one more, yes. And so then in recent years, there were recommendations specifically in 24 to support BDR 95 to ensure opioid antagonists are available on all campuses in the Nevada system for higher education. Folks, I think, can see the full recommendation on the left side of the screen. In 2025, AB 394 was amended to change some dosages and would prohibit disciplinary action for obtaining opioid antagonists. And that was approved by the governor on 6/5/25. Let's just do one more check, but I believe that was the last one from 25. Yes, that was the last legislative update from this year.
Thank you very much for providing those updates. So I do think this is helpful for traction purposes, and I know this subcommittee has really wanted to ensure that our recommendations were moving forward in addition to considering new recommendations. So grateful to have this resource available to anyone who wants to consider additional pieces there. I'm going to move to, I think I will move to agenda item 6 since this is for possible action on number 7. Unless I don't call for a vote, then I think I'll be okay. We'll have one more meeting between now and the SURG October 8th meeting to have this discussion and action it if need be by the committee. So I'll table this one, Kim, for the September meeting. All right, let's move to agenda item number 8, which is our second period of public comment. I will turn it over to Kim to ensure that we're in compliance with open meeting law, and then we'll open for public comment.
Right. During this period of public comment shall be limited to 3 minutes per person. Members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to subparagraph 2 of NRS 241010. If you are dialing in from a telephone, we would ask you to please press *6 so we can prompt you to unmute if you're not able to unmute on your own. We also ask that members of the public refrain from commenting outside the designated public comment periods unless specifically called upon by the chair.
Thank you, Kim. Do I have anybody for public comment in this second public comment period? I will recognize Dr. Maureen Strom.
Thank you so much. And I'm sorry for trying to interrupt earlier out of protocol. I want to thank Dr. Zarley for her great presentation and bringing greater understanding to the issues of naloxone distribution. I have a comment and then a question. Dr. David Hart at Mountain View Hospital has been working for the last several years on a process to distribute naloxone from the emergency room there at Mountain View, and ran into a number of challenges with some of the pharmacy regulations around hospital pharmacies. Somehow, I don't know all the details, but he has worked that out, and I think it's a model. So part of my question is, are there other hospitals that are currently, or other emergency departments that are currently dispensing naloxone, as particular to individuals who are being discharged from the emergency room after a withdrawal episode or an overdose episode? So maybe you don't know that.
Yeah, thank you, Dr. Strom. I know that we usually refrain from responding during public comment period, but I'm happy to
Okay.
connect with you offline to
Okay.
follow up on your question.
All right,
Appreciate
then
you
I'll-
being on today.
All right, and so if I could just get Dr. Zarley's contact info, I'll direct my questions to her directly. Thank you.
Fantastic. Thank you so much. Next on my list is Dr. Terry Kearns.
Thank you, Chair Johnson. Terry Kearns for the record. I just wanted to highlight that the response subcommittee met yesterday, and we had a couple of presentations, and some of the recommendations from those presentations are recommendations that we will likely either pass to the prevention subcommittee or work with the prevention subcommittee to further those recommendations. So one being emergency departments and the other being workforce issues. So more to come. We're in the very early stages of those development, but I just wanted to highlight that for the prevention subcommittee.
Thank you, Dr. Kearns. Anyone else for public comment?
I do not see
Can I
any.
raise my own hand, Kim? I have something to add for public comment. Okay, wonderful. Thank you. I don't know how all of this works, so thanks for helping.
I think we can always check with our DAG representative, but I believe that subcommittee members have engaged in public comment prior. Sorry, Joseph, I saw you come off mute.
I missed the question. I heard kind of what you said, but I didn't
It was
understand.
that subcommittee members are also able to provide public comment.
Oh, absolutely. Everybody.
Thank you. I just wanted to, so Jessica Johnson for the record, at our July SURG meeting, one of our longstanding prevention subcommittee members, Miss Debbie Nadler, resigned her position here on the SURG. And I just wanted to take this opportunity to thank Debbie for her time and service in work at the SURG. She's been a dedicated member of the SURG and in particular, this specific subcommittee, engaged attendance at nearly every single meeting and recommending and suggesting many of the initiatives that this group has moved forward over the years. So I just wanted to take this opportunity to publicly thank Debbie for her time and her service on the prevention subcommittee. And I will miss her in this role and look forward to collaborating with the person that takes on this role going forward. That's all for me. I'll close that piece. Any additional public comment?
Do not see any hands raised or folks coming off of mute.
All right, seeing none, I will move to agenda item number 9, which is adjournment. Thank you to everyone who joined today, in particular, Dr. Zarley, for a wonderful presentation. And I will see you all again in September. Thank you.